thrilled to be here, forming part of this family and helping grow asistensi and scale it globally. So although we launched asistensi in March 2020, its foundation started way before, many years, when Luis Velázquez, one of the other founders, and I were studying medicine. And through our journeys in the hospital, we started understanding how preventive care and how home care could increase the chances of people having a better possibility of not only getting better, but also surviving. So we saw a problem in how the healthcare services worked, and saw the opportunity of starting to transform and shift healthcare from the clinic and hospital view to a home care based service and model. We also saw how traditional healthcare insurance companies worked and how conventional policies rejected some people because of their age or because they suffer from a chronic condition. And being into these modern times where life expectancy is growing with better quality of life, chronic diseases have been also been managed in a proper way. We wanted to be more inclusive. And that's when the migration crisis started, where initially where we saw it in Venezuela, and it started to become serious around Latin America and around the world. And at this point, our third partner and our CEO, Armando Vaquero, joined us after a long trail of experience in the banking industry and in the insurance industry. And that's how two doctors joined with a specialist in insurance to create asistensi. And now, as individuals, as Latin Americans, and as migrants, we understand the importance of providing healthcare coverage to everyone, particularly to those in countries who most need it. And obviously, being in this modern era, we are using technology to address this issue and to connect migrants from one country to their countries of origin, providing healthcare coverage for their families and making the industry more inclusive. We were ready to launch in 2020, and the World Health Organization declared the COVID pandemic. So we had to make a decision, and we took it very responsible to go ahead and launch InsurTech, an insurance business right in the middle of at the starting point of the COVID-19 crisis. We wanted to make a statement about how our model could actually help the world without and with a crisis, a healthcare crisis like the one we had. So we launched in March 2020 in Venezuela. Then we scaled to the Dominican Republic, which is also a country that has a lot of migrants, principally in the United States and Europe, in July 2021. And to Mexico, we started operations in October 2021 with an excellent reception. In the few weeks, we will be opening Honduras, which is another country in Central America, which has a lot of migrants and a huge opportunity and necessity for their people to be covered. And we plan to set up operations in Guatemala in the first quarter of 2022 and the Philippines between the first and second quarter of next year. Our client base has been growing steadily since we launched, and we're proud to serve thousands of Latin American migrants across the United States, Europe, and some other parts of the world. And basically, we're supporting them to pursue their dreams by taking care of their families back home. Talking about this, we're super proud of the stories we're helping to create. So we are collaborating in the dreams of other fellow migrants and Latin Americans. For example, one of our first clients, a Venezuelan living in Madrid, He actually is a doctor, a physician who went off to pursue a better future, thinking about himself, but also thinking about how could he better serve his family. So at one point, his mother had an emergency. It was a respiratory infection, pneumonia, and we were able to treat it at home with excellent results. And obviously, talking to him about the evolution and letting him know that his mother was evolving in a proper manner. And after seeing her, we got a message from this client, from this person, and we usually get messages of thank you notes on thank you for taking care of my mother. But this message was different because he explained, not only helped him in the obvious healthcare ways or for the reasons, but that we were part of his dream now, that he knew he could pursue what he was meant to do in Spain because we were there to help her. So in a way, being a doctor, now we see that we're evolving medicine. We're taking medicine back to the human base that it should have, back to the art of connecting with another human being. And those type of stories are the ones that we're looking for. Before going through the process, it's very important to understand that from our experience in many years of tackling this healthcare issue on how to provide services in the best manner that the outcome could benefit, not only from a scientific point of view, medical point of view, but also from a humanly point of view. It's very important to understand that we are using home care, and we are using, even before home care, telemedicine to start providing a continuous process in healthcare, which goes scaling from telemedicine, where we can actually treat effectively up to 30% of the cases we manage. And then if the patient needs better, more detailed care, we send the doctor to where the patient is, normally their houses, their homes, where they are more comfortable, where they are around their families, and that has a huge impact on how the symptoms evolve. And by sending doctors to where our patients are, we're able to manage up to 85% of all acute illnesses. In Mexico, it's Mexican doctors. In the Dominican Republic are Dominican doctors. In the Philippines are going to be Filipino doctors. We send them, and they can not only check on the symptoms and on the patient, but also include treatment immediately there to try to resolve the situation. If it's not possible to do it, we send an ambulance. So you have the ambulance service included to do emergency transports, and the hospitalization insurance, which basically means that those emergencies, for example, a pneumonia that has symptoms that are evolving in a complicated way, or an appendix that needs to be go down to surgery, we can transport them and have the actual service done entirely included in this plan. Apart from all the emergencies, in Mexico, for example, we have a plan that covers diseases such as cancer and other type of diseases with the highest quality standards in order to provide the best service. There are approximately 10 million first-generation migrants living in the UAE, sending around $43 billion every year in remittances, primarily to India, Pakistan, and the Philippines. 50% of these migrants come from these countries. They send this money because they say it's to cover medical expenses. We therefore anticipate high levels of demands across the region, and in particular Dubai. The main advantage of establishing our base in the Emirates is that we will improve the well-being of these migrants that work in the UAE, and that we want to make sure they can continue to thrive in their pursuit of their dream and their work without having the financial shock that could mean to have an emergency of one of their loved ones back home. So this is why Dubai and the UAE is so important for asistency. Our ultimate mission is to make migrants the heroes that take care of the health of their families back home. And we want to see a world where there's inclusion and nobody gets left behind in terms of medical coverage for emergencies. So this strategic partnership in this region of the world comes at a particular time in history where we see our solution as a global tool for helping solve this healthcare problem, which is not only present in developing countries and developing economies, but also it's a necessity of developed countries. And we want to make sure these migrants in their pursuit of their dreams in the developed world also has a direct impact in countries like the ones we are operating. So through our partnership with the Seed Group, we see a direct contribution to the expansion of this model around the world and helping millions of human beings have a better life and a better healthcare.